Good morning and welcome back to the Livingston Parish News Morning Show. My name is McHugh David, publisher and editor of the news. Appreciate you guys joining us this morning. If you're watching us live, thanks for that. If you are watching us later or listening to us later, we do upload these shows to www.livingstonparishnews.com/podcast. We do appreciate that as well. Still trying to get a little used to my mic setup at home, but we do appreciate you joining us, and we do appreciate you if you are staying home as you should during this time. We also want to give thanks to our healthcare workers and those who are essential who are going to work still. Right now with your traffic, it's looking relatively clear. Of course, no school at the moment. And of course, essential workers only going to work. It's about 7:45 here on Thursday morning. It's currently 53 degrees, going to get up to almost 80 today. So we're going to have a big spike in the temperature. Then it's going to drop again, going to be about 60 overnight. It's looking like it's going to be cloudy today. No rain or anything like that. Maybe some afternoon thunderstorms if it gets real hot. But otherwise, looking pretty cloudy. Another spike yesterday in the amount of coronavirus cases in Louisiana, 6,424, not 60, 6,424 total cases, 273 deaths, 1,498 hospitalized, 490 of those are on ventilators. So please let's remember these mitigation efforts. Let's wash our hands for at least 20 seconds with soap and water. Let's disinfect common surfaces in the office and at home. Let's stay home if we're sick. Stay 6 feet away from others in public places, and control your sneezing and your cough using an elbow or tissue. These are going to go a long way towards helping us get out of this. Now, before we get into trying to get out of this, we also want to discuss a couple of things. Please remember that Monday, Wednesday, and Friday, there is a commercial testing site for COVID-19 or coronavirus at Our Lady of the Lake, Livingston. It is open from 10 a.m. to 11:30 a.m. Monday, Wednesday, and Friday. So please remember that. Right now, we only have 25 confirmed cases of coronavirus in Livingston Parish on 138 tests. You can expect that number to go up. Mr. David Gray did visit the site yesterday. He's going to be coming out with some information today on how it works and about how many tests are going to be performed today. However, one thing that we do have is a confirmation of a death from a Livingston Parish resident from coronavirus. That would be Terry McGee, a 53-year-old from the town of Livingston. We don't know where he was in the hospital. We don't know exactly when he died or anything like that. We believe that he died early yesterday, might have passed on Tuesday. We're not entirely sure of those details yet, but we do know that it is Mr. Terry McGee, who, as we mentioned, is the first Livingston Parish resident to die. So please remember, those mitigation efforts are wildly important these days. We have our first death here in Livingston Parish. And remember, if you are sick, please call your doctor, schedule a test. You will have to have a doctor's confirmation to go get tested. Utilize telehealth to get that confirmation. That means FaceTime them, Skype them, call the office, whatever you have to do. Describe your symptoms, and they will recommend whether or not you should go get a test. Please remember that commercial site is open at Our Lady of the Lake Livingston campus, which is in Walker. It's from 10 a.m. to 11:30 a.m. Monday, Wednesday, and Friday. Now, we want to remind everybody something that President Donald Trump said on Tuesday evening. And of course, this brings those mitigation efforts and the social distancing right back into the forefront. The federal government is expecting this to get worse over the next 2 weeks, as is the governor. We're going to talk about some of the governor's comments from yesterday in just a second. But we want to talk about what the president said in terms of, social distancing, mitigation are some of the things that are going to keep this from getting as bad as it could. For a lot of people, still, this just doesn't seem real. They're still kind of going out, doing their own thing. I got a couple of dirty looks in Carter's yesterday when I went to go get my groceries because I had on my painter's mask, my little respirator, and gloves. But I'm not risking it. So, one of those things where we need to be practicing these mitigation efforts. There is a reason for it. People aren't crazy because they're taking this seriously. The president said that anywhere from 200,000 to 450,000 deaths could occur over the next 2 to 4 weeks. So we really need to be cognizant of taking care of ourselves, taking care of our family, practicing these mitigation efforts. Now, yesterday, The governor in his press conference said that Louisiana residents need to be prepared for this to last an unpleasant amount of time. One of the things he threw out there, let's walk through it. First and foremost, stay-at-home order is going to be in place for at least another 30 days. We're going to be going through the end of April, or I guess at this point it would be 28 days, 29 if you include today. After that, one of the things that he said is that you're going to have to continue to mitigate and socially distance. Now, then he said through the summer, maybe into the fall. There are a couple reasons that is the case. One, a lot of folks want to say, well, once we get into the summer and it gets hot, this thing's going to die. There are confirmed cases in Saudi Arabia. It's a desert. It's currently 100 degrees during the day, sometimes upwards of 110. This thing is not really affected by weather, and that's one of the things that we're starting to learn about it, which is unfortunate. It's not a good thing. A lot of what, but then again, right after that, he referenced the Spanish flu, and that would be the reason that social distancing and mitigation would have to last through the fall, is that perhaps, it could still be around come fall, and we could still be spreading it come fall. And one of the things we are trying to avoid is putting too many people in the hospital at once. So yes, these mitigation efforts and this social distancing might have to last into the fall. We're waiting for a vaccine. That's really the big deal that could be coming. Now, there's a lot of discussion at the federal government level, including from Senator Bill Cassidy, about sort of herd immunity. What that means is that enough people start to get the virus, get over it, recover, and then are technically immune. Not a lot is known about immunity just yet. There were early reports of folks having it, going to the hospital, and then reportedly getting it again. Still hasn't been confirmed if perhaps that was a relapse. Or maybe it was a different strain. Just still a lot to learn about this virus. But what he did say that these mitigation efforts and social distancing will probably need to last until a vaccine is discovered. And even then, therapeutic treatment is not currently known. There is no 1-2 punch for this thing, especially since so many people end up on ventilators to combat the heavy pneumonia portion that comes with COVID-19. So please remember that, but also remember that those are mitigation and social distancing efforts. That does not mean that the stay-at-home order will last until fall, unless people just start ignoring the social distancing and the mitigation efforts, in which case there will probably be another stay-at-home order. Of course, there's a lot of discussion about the effect this will have on the economy, which is not positive. It is not a positive effect on the economy. However, again, yesterday, so let's move into those discussions of dates when healthcare infrastructure will fail in New Orleans. Of course, we had another huge spike in cases yesterday. Again, up to 6,400. So another 1,200 person spike. We're up to 273 deaths. You're looking at somewhere along the lines of Saturday or Sunday, the state is going to run out of ventilators to hand out. Based on the current course growth of this. Now, they do have some ventilators in the Department of Homeland Security that could be handed out, but as we were told yesterday in the press conference, they are not, they'll only go so far. They are not top-of-the-line, state-of-the-art ventilators. So, it'll be interesting to see if what happens today with the new numbers and how the models change. That number or that date had gone up. We were looking at April 7th or 8th before we were going to run out of ventilators, which, of course, every date that we get to push it back gives us more chance to get ventilators from vendors in the federal government. However, unfortunately, with these two spikes, that date has dropped back and become closer. Now, and again, running out of beds, that date has dropped back and come closer. Now we're looking at running out of bed space in the New Orleans area somewhere at the end of next week, somewhere around the 8th, 9th, something along those lines, which would be next Wednesday or Thursday. Now, how does this affect Livingston Parish? Well, once that capacity in the New Orleans area starts to run out, out, those folks are going to seek healthcare elsewhere. One of the things that I need to bring up with people is we had a conversation with Marshal Joe Mack's shoemate yesterday. Of course, he had the coronavirus, got into the hospital before it got too bad, and was able to get out and kind of tell his story. And one of the things that he wanted to impose on people is that the Baton Rouge area healthcare system is already strained. Already. We just don't have the healthcare infrastructure designed for this many patients all at once. One of the things that we've compared this to is Italy. We have fallen behind Italy some 500 cases in terms of raw cases. That's total net cases. Unfortunately, Italy has a healthcare infrastructure built for 60 million people. Louisiana has a healthcare infrastructure built for 4.7 million people. And that's about, so once we have a number that's about 1/15 or less than 1/15 of Italy, because even at 15 times our population, they still overwhelm their healthcare infrastructure. Once we have a lower number, I think people can start to feel safe. But right now that number doesn't exist. It only continues to grow. So even 500 behind Italy is not enough. We need to flatten this curve. We need to stop the spread as soon as possible. Because again, as Mr. Shoemate said, they're already stressed there. They're, having to utilize parts of the hospital that were not designed for personal care. They are having to work 12-hour shifts. These are nurses and doctors. They're having to suit up and suit down constantly to come check on patients. And of course, there's the death toll. I mean, that has an effect on people. So again, a lot of people want to compare this to other diseases and things as well that do kill people. The problem is that this is not, some of those other diseases are genetic. Perhaps they come from personal choices. This one just spreads, and it has a pneumonia portion, and it tends to kill people. So if we run out of ventilators, that death toll is going to start increasing rapidly. And of course, if we run out of ventilators and bed space, they're going to, these patients are going to try to find places in other places of the state to try to go to the hospital if they even can. We've never run into a situation like that, and they might already be too stressed. They might get turned away in New Orleans and turned away in Baton Rouge. So please remember to stay home. It could save lives. Please stay home. According to the marshal, like we said, we caught up with him. He was in New Orleans early in March. It took him almost 7 days to get his test results after having fever and a dry cough for several days. Food didn't taste good. During the time that he was waiting for his test results, he lost 15 pounds. He eventually ended up in the hospital for about 3 days. They used Plaquenil on him, which is that malaria drug that President Donald Trump has discussed. It works on some folks. It doesn't work on others. For Joe Mack, thankfully, it worked. And by day 2, he was in there for 3 days. They gave it to him the first day. By day 2, he was feeling better. By day 3, he was feeling even better. And on the beginning of day 4, they discharged him. He was not given a second test to determine whether or not he officially recovered from it, but his fever had been controlled and a lot of his symptoms had receded. So they went ahead and sent him home with the idea that he would continue to be on a 14-day quarantine. They did not describe to him exactly how contagious he still would be. So please keep that in mind. He sent out a message to the community. Please do not go out. Please stay home. Only go out if you need to. Even just touching a box in public, this thing lasts on several different surfaces for several hours, and in some cases up to a day on some metal surfaces. So please remember that this thing hangs around. You touch a box, you bring it home, you get your whole family sick. So please remember that Joe Mack is home. He did recover, but not officially. He was not tested again. Testing, of course, nationwide is still a problem. But he is home and is under a 14-day quarantine. So please remember all these items as we roll through them. They all kind of package together, and we're all in this together. I mean, that's why, Coach Ed Ogeron said, stick to the game plan. That's why, Governor John Bell Edwards continues to tell people, we're in this together. Everybody needs to practice this statewide. Because it's already spread to other areas, and it's only going to get worse from here. And if New Orleans, one of the reasons they're constantly talking about New Orleans and constantly focused on New Orleans is that if it gets out of New Orleans, then there's going to be some serious trouble. If New Orleans healthcare infrastructure is overwhelmed, those people are either going to die or they are going to try to find health care elsewhere and start straining other hospitals. So please keep those things in mind. Please do not go out unless you need to. Try to stay at home and do work. If you have to go to work, please remember 10 people or less in the office, keeping 6 feet in between you, washing your hands constantly throughout the day, and disinfecting common surfaces to try to keep this thing under as much control as we can. Some fallout of that, the governor did say that he is going to sign a proclamation either today or tomorrow. It's going to be lengthy because it's going to include everything that he's done up to this point, but it is going to put into effect the stay-at-home order until April 30th. The most important thing is there's going to be some changes to the protocols, especially with regard to the parish, the school system, and things like that. We will be waiting for them to release those statements as soon as that written proclamation's in their hand. But we do know that as soon as that written proclamation is in their hand, and we do know that they have been working on adjusting their protocols already with the knowledge that it is coming. So we do expect them to have a quick answer as soon as that proclamation is released. So we will let you know what kind of changes are coming to parish offices and services, and also the municipalities, as well as the school system, as soon as that date is extended. Again, the schools were supposed to return on April 20th. They were going to recognize spring break. This is another 10 days. We're not sure where they're going to end up, and we're not going to speculate. We will let you know as soon as they give us an answer. And speaking of schools, pre-K and kindergarten registration has been postponed indefinitely. They are just not sure what's going to happen with this school year, and they are not sure what's going to happen in the future. So they have went ahead and discontinued that for the time being. The school system will make an announcement when that registration reopens. Athletic Director J.R. Teagues and baseball coach Matt Reiser from Southeastern Louisiana University, which actually Southeastern had a confirmed case of someone who was living on campus. So if you were at Southeastern Louisiana University, you might want to self-quarantine or something like that if you were living on campus. But the athletic director and baseball coach talked about spring eligibility. The NCAA announced that spring athletes at college would be given another year of eligibility because, for the most part, the majority of their season has been canceled. Both gentlemen described it as a huge win for the student athletes and a huge win for the institutions. You can read about that at www.livingstonparishnews.com/coronavirus, or you can check it out under the sports page if you are a subscriber. Mighty Moms announced a to-go sites, multiple. They will be handing out food to needy families just as quickly as they can at these to-go sites. You can find a full list of those at www.livingstonparishnews.com/coronavirus. Of course, this is a great time to mention that all of our coronavirus information is free. We are putting it out just as quickly as we can, and it is free to the public at that URL. If you want to sign up for these meals, you do have to sign up. Text GIVE to 225-269-1151. Or visit mightymomsgo.org. Again, text GIVE to 225-269-1151 or visit mightymomsgo.org. We also want to remind folks, please do not gather in large public places, or please do not affect large gatherings in public places. Want to keep that to 10 or less. One of the things that Parish President Leighton Ricks said just 2 days ago is that he will close the waterways completely if we cannot trust people not to have these large gatherings on the river like what happened at the prop stop this past weekend. Also, it does appear that law enforcement is going to be getting involved in these large gatherings, so please keep that in mind. Trying to disperse them. The pastor from Central has officially been charged by East Baton Rouge, so we will see where that goes. But again, law enforcement seems to be getting involved. We're going to try to connect with the sheriff today to see if he's changing his protocols, but they're not trying. The governor said they're not trying to enforce their way through this, but it does look like that may be, the state may not be, but they may be giving power to local law enforcement to try to disperse these large crowds. So please keep that in mind. One last time, 6,424 cases in Louisiana, 273 deaths, 1,498 hospitalized, with 490 on ventilators. 25 cases in Livingston Parish, 138 total tests. Please remember that there is a testing site open at Our Lady of the Lake Livingston campus that's in Walker. It's open Monday, Wednesday, Friday from 10 to 11:30. Please connect with that's AM. Please connect with your doctor first to get the okay go to go up there and get tested for the coronavirus. Right now with your traffic, it's looking relatively clear. It's currently 53 degrees, going to get up to 80 today. So it's going to be warm, but it's going to get down to 60 overnight. So we're looking at those late spring spikes in temperature. They're wonderful. One last time, my name is McHugh David, publisher and editor of the news. Appreciate you guys joining us this morning for the Livingston Parish News Morning Show. We are on Facebook, Twitter, LinkedIn, Instagram, and YouTube. We are once a week in print on Thursdays. We are on the internet. We have a website, www.livingstonparishnews.com. We have an app to go with that. Please remember, as mentioned, www.livingstonparishnews.com/coronavirus. Plenty of information coming out every day that is free. So that part of our website is free and open to the public. Once again, want to ask folks, please remember the mitigation efforts. Washing your hands for 20 seconds or more with soap and water. Disinfecting common surfaces at home or at the office. Staying at home if you're sick and utilizing telehealth to get in touch with your doctor. Staying 6 feet away from others. Control your sneezing and cough in 10 or less people in public gatherings. These are very important to try to curb the spread of this thing because we're going to be looking at 2 pretty bad weeks. We hope you do have a great day, though it's shaping up to be a beautiful day. Please try to stay well. Please stay safe, and we will check you out tomorrow morning.